Thank you, Dr. Nouri, and thank you everyone for making it to the second half of the abstract session. My name is AJ. I'm from the University of California, Irvine, and I'm very excited to present to you today ironing out hyperpigmentation, the treatment of iatrogenic cutaneous siderosis with energy-based devices. So, iron is an essential element in the human body. It serves a number of functions, but most importantly, it creates hemoglobin, which allows us to, of course, transport oxygen throughout the tissues in our body. But for many reasons, we become iron deficient. And when we become iron deficient, we require blood transfusions or iron supplementation to help fill that gap. An uncommon but observed side effect of iron supplementation is cutaneous siderosis, where you have the deposition of iron, the extravasation of iron into your skin, into the epidermal, the dermal, and the subcutaneous layers of your skin. And so this brings us to our case, a 41-year-old female who has a history of iron deficiency anemia from Crohn's disease. She received an infusion of IV ferric carboxymaltose, and 12 hours after infusion, she developed soreness and bruising in her left arm. 18 hours later, developed a green discoloration, and then 24 hours after her infusion, she started to see a brown discoloration that just would not go away on its own. So when she presented to our clinic months later, she had this well-demarcated, brown, hyperpigmented patch on her left antecubital fossa that would not go away self-resolving. So for us, assessing this and looking at our management options, we decided to treat this similar to how you might treat a tattoo, that you have an exogenous pigment and now you're trying to get rid of it. So with that, we decided to choose 3 test spots and treat them with different lasers. And as you can see here at low power, or you just have to trust me, we saw some spots that had moderate improvement, some that had great improvement, and some that had no improvement. So let's just take a little closer look at these 3 spots. The first was treated with the ND-YAG 532 picosecond laser, and this showed some moderate improvement. Our best improvement was seen in the nanosecond version of the same laser, and then we had no improvement with the ALEX laser picosecond pulse duration. So once we committed to that 532 nanosecond laser, we were then able to treat our patient fully. So again, these were our test spots that we were able to complete. We then did a full treatment throughout her whole arm and able to do a second pass as well. Our patient's coming from Brazil, so it takes a little bit of time for her to fly over, but the process is ongoing, the process is promising, and the process will continue just next month. So just going back to the physiology of cutaneous siderosis, again, it's that the pigment is found in the macrophages of your dermal skin and your subcutaneous tissue. It's from the common IV products that we use for iron supplementation. Iron sucrose, iron dextran are what we see most commonly, and what's key is that these particles are quite small. When compared to a black tattoo ink particle, for example, it's around 1/5 or 1/10 the size. And yes, this is drawn to scale. So how do we choose our laser? Well, the first thing we do with any type of laser is figure out our chromophore and figure out what wavelength we want to target. And so with iron, our absorption peak is between 500 or 700 nanometers. So choosing a 532 nanometer laser really makes sense in this case. And then second, if we're thinking that this is akin to tattoo removal, then we want to try to make use of the photoacoustic effect that we see with nanosecond or picosecond lasers. So that's really how we went to our 532 nanosecond or picosecond lasers, which worked really well for our patient. And this inspired us to conduct a systematic review to see what else is out there, what else have people tried. And what I want to highlight is that these patients required multiple sessions, around 5 on average, but the majority responded, 74%, and almost half had complete clearance. So with that, I want to leave you with 3 points today. The first is that the iron particle is a lot smaller than that of your traditional tattoo particle, and it can reach that subcutaneous fat. Second, the optimal wavelength for iron spans between 500 and 700 nanometers, and we should use a nanosecond or picosecond laser to make use of that photoacoustic effect. And then finally, multiple treatments are needed, but not all patients respond. So although you will have to counsel and temper expectations, I hope you can leave here today knowing that you too can iron out hyperpigmentation. Thank you all so much for your time. On behalf of my team, I'd be happy to take any questions.